Woods needs no introduction, part of the team from Western Sydney University who've been working for, I don't know, yonks in this area, 10, 15 years, 20 years, working, probably pioneering men's studies in Australia, and certainly among the very early pioneers of men's health in Australia. Michael Woods, thank you so much.
Thanks, Warwick. Look, I am part of a team, but fortunately the other team members will get to say their bit during the day too, so I can just say my little bit here. I think most of us are very well aware, everyone here, and I've spoken to a lot of people here today at various times, we're really well aware that the social forces that drive the well-being or otherwise of men and boys in our world today. And I believe this is a really opportune time to try and turn some of that energy that we've used to push towards a men's health policy. We did nearly have a men's health policy actually in 1995. It was almost there. We almost fell over the line, but then the government changed and we lost that opportunity. It's taken that long to get there, to get back to that same point of having a national policy. Fortunately, there's no way that we're going to miss out now. But I do think we need to turn our attention to the nature of that policy. I still am a little bit cautious in believing that this is going to address a lot of the things that we've been concerned about for so many years, that most of you here share those concerns about the social nature of health and what drives that. I think some practical things that we can be doing today and in the next few weeks too. It's our last opportunity to try and influence the shape of the policy. It'll be being formed today over this period of time immediately in front of us. It's our last chance to really try and ensure that some things happen that will make sure this policy goes well. Some of the factors of implementation, and one of the things that a lot of people have addressed in the writing in the little booklet that we've got today, is around this question of a coordinating mechanism. And you know, I'm happy to have discussions with anyone about the nature of that, but I think many of us agree we need some form of coordinating mechanism to ensure that the policy is bedded down, that it is driven forward. We can learn from what's happened in Ireland. We've been in touch with Noel Richardson and Paula Carroll, who are the two drivers of the Irish men's health policy, the ones who are charged with trying to see that being implemented at the moment in Ireland. And isn't it wonderful that the Irish, first country in the world, do have a national men's health policy? You know, it's a great gain for them. But there's some learning to be got from there, and I think the principles that they've espoused in their policy, those principles, the 7 principles, are very important. But the one that I'd like to draw our attention to and really push for and encourage other people to advocate for today and in the short term is this idea of some sort of coordinating mechanism to tie things together for men, to make sure that our health is being looked at across government instrumentalities. The Department of Health has very little to do with fathers, has very little to do with boys' education. It doesn't have a lot to do with unemployment, doesn't have a lot to do with workplace accidents and injuries, divorce. All of those areas that we know are so powerful in determining men's health are the ones that we want some attention being paid to. It can't happen from the Department of Health. We need somebody beyond that department, perhaps located in that department, but one that has a responsibility across government instrumentalities to make sure that we do in fact see that men's health is being addressed well. We need implementation plans. This body, I would hope, and it's not just sort of passing the buck saying, well, someone out there will fix it all up. This body, hopefully, will be one that will be able to ensure that the states take on their responsibilities, because a lot of the delivery of health lies in the state government, not in the federal government. So we need to ensure that that is happening across the different states and their different governments, that things are occurring in appropriate ways across all of those instrumentalities. That's basically the main point I'd like to make today, just to encourage that. So thank you for your time.